So anybody who has a concern or a question, you're free to raise up your hand or unmute your mic and speak up.
We seem to have a silent audience, or I've bored them all.
I'm wondering because once in a while we get questions.
So
Or
I'm
probably
either bored.
the other thing, maybe you're not boring, you've explained everything and they've understood. That's also a
Or you
possibility.
did a good job.
Yeah, thank you. But you guys are doing an amazing job.
No, we're trying. I think there's a lot that can be done, and everyone's moving into this space. But the important thing is to get it done the right way.
Yeah.
And I think having professionals and doing it the right way and not compromising on care is of essence.
Okay. And actually, I have a concern. If I
Yeah,
may ask,
sure.
how do you have any medical doctors on call who might, let's say, for example, for most of these drugs that you're looking at for coagulopathies and bleeding disorders, they have to be prescription-only medicines. So do you have maybe doctors on call who can help them review their prescriptions and such in case someone has a concern?
So we've partnered up with a couple of online platforms. There is Sasa Doctor, there's Afia Doctor. There's a couple of different partnerships that we're working on so that a patient can be referred to them. We try and make sure that because they're also want to make sure the consultation is fair. You don't want someone to be paying a stupid consultation. So we have organized such sort of engagements with them so that the client can at least get their medication and we're not breaking any regulations. So yes, it is in place.
Oh, perfect.
And it is growing day by day.
That's great.
Because people find it convenient. You know, I don't want to refuse someone to get their Lipitor, but I obviously at the same time need to make sure that they've been checked. Their statins have been done every 6 months. That they haven't been taking the same one for the last 6 years. So we do make sure we run it past them if we think, and make sure a doctor gets involved. Well, it's not our own, it's an external partner who's good at that.
Oh, okay. That's understandable. And then for the tests, for example, like some of the things that we're looking at, prothrombin time and all that, do you have any lab partners?
Good question. It's our next project.
Oh, it's the next project. Perfect.
It came too fast. COVID came and so we were just trying to get our pharmacy online. So we've got to speed it up a few notches now and take it. But obviously, the labs or the people that we're partnering up with. So I know Sasa Doctors and also the other groups that we've partnered up with, Daila Daktari, they already have engagements with labs so that the labs can come and I think some of them also come and take lab tests from home, and then it's all done online.
Yeah.
So reducing the risk for the patient even further.
Okay.
Yeah. So that's the way we're heading. In a month's time, we'll probably be more refined. But yes, they do. We are working with partners. So we don't do the test. We just take it to a professional who then will do the tests, get the results, and then give you the advice. Prescription then comes back to us to refill from the doctor. And then we deliver it to you with any other items or whatever you may need.
Perfect. Actually, that's the way kind of technology is coming on board. We're having telemedicine where consultants are remotely, pharmacy products are prescriptions are being filled remotely, and the lab tests are also being done by other people who are working virtually in a way, but they get the samples, which is amazing development. Yeah.
No, true, very true. I've seen a question here.
Oh, okay.
And it says, does MYDAWA collect data on adverse drug cases from their patients? So yes, we do. We actually just had a training last week on pharmacovigilance, and we've got a team on board. Our farm techs collect the data, we feed it in, and the fact that we have a call center is very good, because sometimes you'll get a patient calling you saying, I bought this product, but it looks different. And I'll give you an example. I think there was the Bayer Clarinase packaging that changed. And patients, you tell them, no, it is the same product. So we do collect information. We are currently also working on now feeding that information through an agency that we've partnered up with to handle all our pharmacovigilance issues, whether it's drug reaction, whether it's packaging, product information, we're collecting all that data as well.
Oh, perfect.
Yeah.
And then there's another question, yeah?
Yeah.
So how do you operate for patients outside Nairobi?
So for patients outside Nairobi, we have been a bit skeptical because we need to make sure that it's not a fridge line or it's not a controlled substance.
Mm-hmm.
If it's a normal prescription and it is something that we can confirm, we have partners that we deliver overnight and the delivery is done and it gets received by the patient the next day. So MYDAWA does 4-hour delivery anywhere in Nairobi.
Mm-hmm.
Within 4 hours, your prescription item or your personal item is delivered. If it's outside Nairobi, it goes overnight. Obviously, the patient will have to pay for it, but the charges are nominal because we've agreed with our partner who delivers for us. And we also make sure we audit our partners to make sure that the supplying quality of the products and how they maintain the temperature and everything is adequate. But we don't do fridge lines currently or controlled. These are just normal chronic care meds.
Oh, okay. And just another concern. Let's say, for example, some of these conditions that we've been looking at are chronic conditions, and it means these people have to be on their medicine probably like they're lifelong medicines. So do you have refill options? Let's say, for example, a patient has been managed by one of your partner doctor groups, then now they need to continue taking their medicines unless there's a review that's required. So do you normally remind them, because there's the refill issue might be another concern?
Yes, refill and reminders. So our app is actually being, we've created a whole new front-end version, which will be rolled out, and the refill and reminders is going to be part of it. So a client will get an SMS saying, you're due for your refill. Currently, we call clients.
Mm-hmm.
So when we notice every month, and we've got a prescription for 3 months, and a patient obviously has bought 1 month, and then they'll come back and buy the next 2-3 months gradually, because they can't afford 3 months at one go.
Oh, okay.
So what we do is we will call them and say, you're due for your reminder, do you want us? And then we go ahead. Yeah.
Okay. Yeah.
And the best thing is that with the insurance, the smart gadgets and stuff, even with COVID times now, they've changed the way, because a lot of patients don't want to put the finger on the smart gadget. So we had a portable smart gadget that goes out, or whether it's MTBA gadget. But now we're working with the stakeholders to come up with an OTP number to reduce the risk of using a smart gadget.
Oh, okay.
Yeah.
And in terms of the insurance, the payment option that you mentioned, are you accredited by NHIF? Because some of the patients are like, how do we get, for example, the people who are covered only by the NHIF?
It's something we are working on. It is a step-by-step process.
Mm-hmm. So
yeah, we will be getting there.
Oh, okay.
We will be getting there because I know majority of the patients are on NHIF, and I know the team is working on it. As I said, COVID came up fast and disrupted a lot. So we're just trying to get the right partnerships in place. We don't want to rush it either. We want to do it the right way.
Okay. That's understandable. Any other person who might be having a question? Looks like you've answered all the concerns that people had.
That's good.
Yeah, you've done an amazing job, and thank you so much for being part of this discussion.
No, pleasure being on here. And like I said, I really enjoyed your presentation. Takes me back to my school days where I've forgotten a few things.
Oh, thank you. Let's have a nice evening, and let's take care not to get infected with corona. Even though lockdown might be lifted anytime soon, we have to take extra measures still.
Sure, and everyone be safe.
Thank you.
Thank you all the listeners, and thank you for the questions, Hezron and Dante.
Thank you.
Thank you. Bye.
Bye.